Hello and good evening. Thank you for watching AP360. I'm your host, Anderson Cooper, and this evening I am reporting to you live from the Philippines, where we're covering a major story of what seems to be the deadliest attack on journalists. We have reports of 57 people who have been abducted and killed in an election-related massacre. We'll be giving you more information on that story later on in the hour. Also here on 360, we will be talking to the Speaker of the House, Nathan Pelosi, who will be giving us an in-depth look of what this healthcare reform that the Democrats are proposing means to the American people. And also later on in the hour here on 360, we'll be taking you to a live town hall debate between the Democrats and the Republicans over this healthcare reform that the Democrats are proposing. Okay, I'm sorry. It looks like we're ready to go on air with Speaker of the House, Nathan Pelosi. Mr. Speaker, thank you very much for joining us.
You're very welcome, Anderson. Thank you for having me on the show.
Mr. Speaker, this bill is so overwhelming that under 2,000 pages, I really wouldn't know where to start with how we can chew up this bill.
Anderson, but this is necessary to revamp our old healthcare system to better serve the American people.
On that note, Mr. Speaker, we'll go ahead and break down the bill into 5 parts, starting with coverage and choice, affordability, shared responsibility, controlling costs, prevention and wellness, and last but not least, workforce investment.
That's fine, Anderson. Let's start out with coverage and choice, since this is the most extensive part of the bill. What's your question?
Now, Mr. Speaker, there seems to be a big difference with what's being drafted in the House versus the Senate version of the bill. And it says right here that your version of the bill has a public health option. Can you give us a little more information about that, Mr. Speaker?
Indeed, Anderson. You see, the provisions of this bill is out to protect the consumers, or the American people. We are on the side of the consumers, and we want to provide an option to the people that would definitely challenge insurance companies who are racking up their prices. And we also want to try to have them compete with public options' low rates. In short, this bill provides a public health option, and in layman's terms, a health insurance sold by Uncle Sam.
On the note of competition, Mr. Speaker, what measures would this bill provide to promote competition?
Anderson, within this bill, there's a section that goes into detail about a new health insurance exchange. Now, this exchange can also be called a marketplace. Within this marketplace, individuals and small employers can shop and compare among private and public health insurers.
Many insurers have set rules that discriminate against someone who already has pre-existing conditions. For example, someone with cancer or heart disease. What provisions are within this bill to protect those consumers?
As I mentioned earlier, Anderson, this bill is set to protect the American people from big insurance companies. This bill will force these insurance companies to no longer engage in these discriminatory practices and must allow anyone with pre-existing conditions to purchase or renew their insurance. This bill will also prohibit lifetime and annual limits on benefits. And on top of that, Anderson, this bill will also limit insurance companies from charging higher rates due to one's health status, gender, or other factors.
Wow, I can't help but think that this all sounds too good to be true, Mr. Speaker.
It's very true, Anderson.
I'm sorry, Mr. Speaker, what's true, my statement or the provisions of the bill?
Very good, Anderson. What's your next question?
Okay. Let's move on into affordability. Mr. Speaker, how are we making sure that insurance will now be more affordable? I'm sorry to interrupt you, Mr. Speaker, but it looks like we have to go on break. Stay tuned right here on 360 as we're keeping them honest.
I am fat. I'm educated. I'm fantastic. I have a degree. What else? I have paparazzis. I graduated.
I'm a fashionista.
I have an MBA. So what? I am a poster boy. I am a phoenix.
Welcome back to AP360. We were just speaking to the Democratic House Speaker, Nathan Pelosi. Mr. Pelosi, same question as earlier. How are we making sure that insurance will now be more affordable for consumers?
Well, Anderson, this bill puts a cap to annual out-of-pocket spending, and this will keep the American people from getting into bankruptcy. Additionally, with the introduction of the health insurance exchange, this will open many market areas in the country to new competition. Also, this bill improves Medicare in the case of the donut hole in the Part D drug program, which it will fill. This bill will also tackle fiscal challenges by accuracy of payments and reforms to the delivery of services. Medicaid will also now be expanded to families who are below or at 133% of the poverty level, and all of this will be federally financed.
Wow, I can't help but feel like I'm a kid in the candy store. Mr. Speaker, are all of these really covered in this bill, and what are the downsides to this bill?
Indeed, Anderson, all of these are covered in this bill.
And what are the downsides, Mr. Speaker?
All covered, Anderson. Next question, or maybe another commercial break?
Okay, well, let's move on into shared responsibility.
That, or we can tackle another part, or long break.
Well, with all due respect, Mr. Speaker, shared responsibility is what's next on the list. Now, Mr. Speaker, it states here that the individuals has a responsibility of purchasing health insurance, whether it's private or from Uncle Sam. Otherwise, if they don't have insurance, they will be penalized with 2.5% of their gross income. Is that true, Mr. Speaker?
Well, Anderson, except in the case of hardship. Mind you, market reforms and credits will also be in effect. But on top of that, Anderson, Uncle Sam also has a responsibility. His responsibility is to provide Americans an alternative insurance that will be affordable while providing tax credits, insurance reforms, and consumer protection.
Well, Mr. Speaker, let's go ahead and move on into prevention and wellness.
Yes, Anderson. In this bill, we encourage the American public with prevention of diseases and wellness by starting right at home, in your communities. We are looking to expand community health centers that will prohibit cost sharing for any preventive services. On top of that, we would like to establish community-based programs that will collect data to identify and address each region's specific needs and health disparities so that we can deliver prevention and wellness services.
And how about workforce investments? Mr. Speaker, what will this bill do for those people who are interested in this field?
Anderson, we will be expanding scholarships and loans for those in needed professions and shortage areas. We'll also be encouraging training in primary care physicians by taking steps to increase physician training outside of the hospitals.
Wow, these are all great incentives. Mr. Speaker, our last point is controlling costs. With all these services being provided, it seems that the bill will need a lot of funding from the American people.
Well, Anderson, one of the bill's main objectives is to tackle the issues right at home. We're going to nip these issues at the bud with stronger prevention and wellness measures. We'll also increase access to primary care and definitely reform the way health care is being delivered. On top of that, the health insurance exchange and public health option will provide competition and more cost-effective coverage. Over time, we're also looking to modernize and improve Medicare to prevent waste, fraud, and abuse of the system.
Well, Mr. Speaker, thank you very much for your time, but it looks like we're running short.
Thank you very much for having me.
Up next, our cameras will be switching over to Peoria, Illinois, where they'll be having a town hall debate over the proposed healthcare bill. Keeping them honest right here on 360. Stay tuned.
¿Qué onda, wey, vato locos? I'm educated, but I'm still fat. Hey, wait, you looking at my G-Star homes? I now have a degree, but still have my paparazzis. Ugh, you look like my G-Star. I graduated, and now I'm promoted to commercial boy. You know what I think? I think I'm gonna turn you into a man, Holmes. I am now a phoenix. Fashionista.
Welcome back to 360. I am Anderson Cooper, keeping them honest. It looks like our cameras will now be taking us to a live town hall debate in Peoria, Illinois. Stay tuned.